While in my beloved Paris, I discovered Ratatouille. A wonderful movie of the same name features a charming rat who cooks up a storm and makes a big splash at a famous restaurant. At an equally wonderful health center in Turner's Falls, Jessica Calabrese has discovered her own special talent by innovating dental programs to deliver the most delicious care as the people of rural Massachusetts so richly deserve. Okay, you too, my little friend Ratatouille. Bon appetit!
Ah, Turner's Falls, the city where anything can happen. With enough ingenuity and passion, no matter where you come from, great things can be accomplished. Why, even a rat can become a great chef. And a dental hygienist can transform community healthcare.
Taking this job was sort of my chance to come in and be the person that says, I think we can do this, and this is how we're gonna try to do it.
We've just been massively lucky to get her.
Jess is really looking forward and thinking about ways to treat patients that I don't think the majority of the people really considered. For example, establishing a dental chair in our area hospital.
Great concept, great idea. Massively difficult to accomplish. She did it all on her own.
To offer access in a hospital setting is tremendous for the entire community.
You ever think about what we put into our mouths?
All the time.
There are possibilities unexplored here. We gotta cook this. Oh, you gotta taste this!
She thinks out of the box often.
Okay, Cindy. Hi. How are you doing today?
I'm doing well, thanks.
Good. Follow me back.
Jess really was aware that the whole healthcare system was changing before we were even aware of it, of how we're becoming more preventive-based. She encouraged us to really break out of our old mold.
Nice weather out there today, isn't it?
It's beautiful.
The new approach really emphasizes the patient as a partner in care, and the idea is that in order to reduce the cost of healthcare, we need healthier people. So the big change for dentistry is, how do we treat the cause of the disease, not just the disease?
She is absolutely committed to this concept of quality dentistry based on outcome. It's a fantastic paradigm shift.
I did notice on your risk assessment form, though, that you answered that you have been drinking a lot of soda.
Yeah, I sip on it kind of all day.
When we're looking at the risk for cavities, we want to look at how often is your mouth really acidic?
She began to set up a comprehensive assessment of the quality of the dental care that was being delivered by the health center so that we could all understand how that was fitting in as a whole and how that would also then become integrated with the medical care that was being delivered.
So we're setting up the system to measure, then we want to look at how do we get better at what we're doing.
Not everyone can become a great artist, but a great artist can come from anywhere.
Hi, Miss Jessica.
How are you?
She does a great deal of outreach as well to the local school systems, and that has been massively well received.
We take mobile equipment into the various schools in the area and we do cleanings and sealants and fluoride and screenings. So that's one part of our school program. The other part of our school program is that we provide a classroom education program. Who knows how many times a day you have to brush?
They always look forward to her coming in. I was very impressed because she's not an educator, yet she was able to make some fairly sophisticated scientific concepts, I think, clear to the kids.
Teaching the children from the get-go hopefully will bring up a new generation of science-savvy kids and grown-ups.
Jess is her own ingredient. I think there's no one like Jess, and we're just very lucky to have her.
In a short time, she's done a tremendously incredible job for us and has made a big impact, I think, on this community.
Our patients just don't always have the things in life that they need, and we have the opportunity to change lives. You know, my life was changed by a health center in a lot of different ways, and I feel like I get to work in that role and potentially change lives too. And that's just an amazing thing.